Hey guys, Siju here, and today's video is about calcium hydroxide placement. Now the reason I'm doing this video is I received a mail from a colleague of mine a few days ago, and he was trying to do endodontic therapy for a patient of his in his practice, and he placed calcium hydroxide in a particular patient, and the patient had a lot of discomfort because he had extruded calcium hydroxide beyond the apex, and he mailed me a radiograph of the case, and it looked something like this. Now this set me thinking, because sometimes some procedures as simple as calcium hydroxide placement, if not done the right way, can lead to a lot of serious complications in your clinical practice. So let me show you how we go about placing calcium hydroxide in everyday practice, and let me try and tell you some of the things that you can do to avoid complications of calcium hydroxide placement in your practice. Have a look.
We mostly use Apex Cal from Ivoclar Vivident and UltraCal from Ultradent, both of which are aqueous solutions of calcium hydroxide. Occasionally, for open apex cases, we use something called Metapex, which is calcium hydroxide mixed with iodoform. This is much more thicker than the other forms of calcium hydroxide, so you don't want to use it in regular cases or in narrow canals because it just doesn't go through. For inserting the calcium hydroxide into the canals, we use delivery tips. We use Navi tips from Ultradent, or you have plastic delivery tips which you see at the bottom from multiple companies. The top two, the blue and the yellow, are Navy tips, and these are the easiest to use. You can insert them into the tube, into the calcium hydroxide tube, and you have stoppers. You can adjust the stopper as well, and then you can just extrude it into the canal. The plastic tubes, delivery tips are again used the same way. You just attach it to the calcium hydroxide tube and just inject. The Metapex, the thicker version, calcium hydroxide mixed with iodoform, cannot be injected through the Navy tips. If you compare the Navy tip on top with the plastic tip down, you can see the plastic tip is much more bigger than the Navy tip. The Navy tips are too small to inject the iodoform mixed with calcium hydroxide. So for Metapex, we use the bigger plastic tips. So these are used to inject the Metapex. Actually, you can see the Metapex is actually much more thicker. You can see how slowly it flows. So you select the Navi tips and you place them in the canal. Before that, you adjust the stopper, and the first thing we do is we inject a little bit outside the tooth, so to make sure that it's flowing, because sometimes Navi tips do get clogged. So once you know that it's not clogged, we insert it into the canal, adjust the stopper to make sure it's within the working length. Okay, that's the first step. Second step to make sure is that it's not binding in the canal. So if you look closely, you can see that the needle is actually binding in the canal. Now, if it is binding and you start injecting, then you're going to get what the kind of clinical scenario that you see on the radiograph on the right side. So you make sure it doesn't bind. Okay, when you pull it, it should not be binding in the canal. It should move freely, like what you're seeing right now. So once you know that it's moving freely up and down, then you inject a little bit of calcium hydroxide into the middle or coronal third. And once it is in the middle or coronal third, you use the needle to carry it deeper into the canal. So you inject a little bit in the middle coronal third and then push it deeper using the metal tip. So we keep repeating this about 4 or 5 times till the entire middle or coronal third is filled with calcium hydroxide. And once we're sure that's done, I like to take the master cone into the canal up to working length. So here we see we put the master cone all the way to working length, and this makes sure that the calcium hydroxide is carried all the way right up to the apex. So you can see, if you zoom in, you can see how the calcium hydroxide has gone right to the apex. One of the problems that a lot of practitioners write in is that they can't afford Navy tips, especially when they're practicing in rural areas and the root canal fees are low. They want to find out if they can place calcium hydroxide without Navy tips or without delivery tips. So I'm going to try and show you how we can do that. I'm going to put calcium hydroxide into the other canal without using Navy tips. We're just going to use Gadaperka cones to carry the calcium hydroxide. So for this, I like to use the 2% tapered cones, not the 4% tapered cones. So we inject a bit of calcium hydroxide into the mixing pad, and then we coat the Gadaperka cone, which fits to working length, which is already pre-checked, and then we cover this with calcium hydroxide, and then we use that as a medium to carry the calcium hydroxide into the tube. Initially, you see when you do that the first few times, there won't be any calcium hydroxide left in the Gadaperka cone. So you recoat the cone again and then carry it again into the canal. So you keep doing this multiple times till the canal gradually starts getting obviously it's a bit more time consuming than navy tips, but there will come a stage where when you insert in the canal and take it out, the Gadaperka cone comes out with calcium hydroxide still in that. So when you actually zoom in, you actually see there will be a stage where the entire canal gets filled with calcium hydroxide. So this is how you can place calcium hydroxide without using navy tips or any other delivery tips. Now a lot of people like to use cotton after this. Here you can see they plug in cotton around the calcium hydroxide and then cover this with temporary, but we don't like to use it because if you actually zoom in, you can see those cotton fibers, they tend to stick out and then they act as capillary tubes to draw saliva into the canal, so they can contaminate the canal. So we don't use cotton. Instead we plug Cavit G directly into above the calcium hydroxide, straight into the canal. So you can see me applying pressure with a plastic filling instrument. This can be easily removed with ultrasonics during a second visit when the patient comes back. So after that, we apply pressure with a wet micro brush to plug the cavit into the canal, and we don't leave the cavit alone. We cover the cavit with glass ionomer cement. So we use glass ionomer as a temporary filling material.
Alright, so those are some of the guidelines that can minimize complications from using calcium hydroxide in everyday practice. Do let me know whether this short video helped you or not. You can keep in touch by logging on to our websites. The links are coming up after this, and keep in touch.